Ways to prevent diseases, health, and wellness. Of the 57 million deaths that occurred globally in 2008, 36 million, almost two-thirds, were due to non-communicable diseases, comprising mainly cardiovascular diseases, cancers, diabetes, and chronic lung diseases, according to the World Health Organization. Table of contents. Leading causes of death worldwide and the United States. In the United States, according to the Centers of Disease Control, in order, they are heart disease, cancer, stroke, and lower respiratory disease. Worldwide, according to the WHO, it's cardiovascular disease, heart disease, cancer, respiratory disease, and diabetes. As you notice, there's two differences on these lists, and we'll be discussing them later. Heart disease. According to the Center of the CDC, there's about 610,000 people will die per year in the United States, heart disease related, and 17.5 million people died in 2012, according to the WHO. Leading cause of preventable disease is cancer. According to the CDC, some of the main risk factors that contribute to cancer are tobacco use, obesity, poor diet, lack of exercise, sun exposure, viruses and bacteria, ionizing radiation, certain hormones, chemicals, and other substances. According to the CDC, 591,699 people are projected to die in 2015 in the United States due to cancer, and worldwide, according to the WHO, in 2012, 8.2 million people died. Stroke. This was listed on the United States top 4, but not worldwide. According to CDC, some of the main factors that contribute to stroke are high blood pressure, high cholesterol, heart disease, diabetes, poor diet and exercise, overweight and obese, previous stroke, tobacco use, and heavy alcohol use. According to the CDC, 133,103 people die a year from stroke in the United States. Respiratory disease. According to CDC, 147,101 people a year die in the United States from respiratory disease, and according to the WHO, more than 3 million people die a year from COPD alone, which is only one respiratory disease. Diabetes. This is on the worldwide list, but not the United States list. And why is that? Well, according to Zablocki 2000, some of the main factors that contribute to diabetes are overweight, obese, impaired glucose tolerance, insulin resistance, ethnic background, family history, high blood pressure, low levels of good cholesterol, age, and sedentary life. Diabetes is one of the leading causes of visual impairment and blindness in developed countries, according to the WHO. Ways to reduce preventable diseases. The big 4: tobacco use, physical inactivity, unhealthy diet, and harmful use of alcohol. The 4 modifiable risks that can be controlled by the individual. Eliminating tobacco usage. Smoking is estimated to cause 71% of all lung cancer deaths, 42% of chronic respiratory disease, and 10% of cardiovascular disease, according to WHO. Increased physical activity level. 150 minutes of moderate physical activity a week significantly decreases your risk of heart disease, diabetes, cancer, and stroke, according to WHO. Eat a healthier diet. Adequate consumption of fruit and vegetables reduce the risk of cardiovascular disease, stomach cancer, and colorectal cancer, according to the WHO. And decrease harmful use of alcohol. There's a direct relationship between higher levels of alcohol consumption and the risk of some cancers, liver disease, and cardiovascular diseases, according to the WHO. Ways to reduce preventable diseases. Besides the big 4, here's some of the other ways you can help reduce preventable diseases. Annual physicals, early detection efforts, screenings, cancer screenings, management of existing diseases, maintaining healthy blood pressure and cholesterol levels, get vaccinations, and reduce salt intake. Not making the cut, stroke. This did not make the cut in worldwide, but did in the U.S. And why is that? Well, there's other factors that have an influence on your health, according to healthy people. Economic stability, education, social and community context, health and healthcare, neighborhood, and built environment. The prevalence of insufficient physical activity rose according to the level of a country's income, according to the WHO. The U.S. has become a technology-driven society and as a result has become less active and don't eat as healthy as we should. Not making the cut, diabetes made the list worldwide, but not in the United States. Why is that? Well, the U.S. has a reputation of having good healthcare providers. People with diabetes require at least 2 to 3 times the healthcare resources compared to the people that do not have diabetes, according to the WHO. Other countries don't have the money or the healthcare resources to fight diabetes like the U.S. does. Much of the world outside the U.S. does not have access to healthcare like we do. Physical situations can also play a role. Do you live where you have access to healthy food is an option? Do you not have access to healthcare? The 7 dimensions of wellness. Wellness is an active, lifelong process of becoming aware of choices and making decisions towards a more balanced and fulfilling life, according to North Dakota State University. The 7 dimensions are physical, intellectual, emotional, social, spiritual, environmental, and occupational. Constantly attempting to attain a high level within each of these 7 dimensions of your life will dramatically improve your overall wellness in life. Physical dimension, according to the CDC, pertains to the functional operation of the body in relation to your health-related components of physical fitness, dietary habits, medical self-care, and managing your environment to minimize harmful pollutants. Taking charge of your physical body with exercise, healthy diet, annual physicals, and not allowing any harmful thing to enter your body. Intellectual dimension. Always continue to learn, keep your mind stimulated. This would include reading a book, learning something new, visiting a museum, doing a crossword or Sudoku puzzle, even watching an educational program on TV. Emotional dimension, 3 areas: awareness, acceptance, and management. Awareness involves recognizing your feelings as well as the feelings of others. Acceptance means understanding the normality of human emotion in addition to assessing your personal abilities and limitations realistically. Management is the ability to control or cope with personal feelings and knowing how to seek support when necessary. Social dimension, the ability to accept people for who they are and interact with them. This dimension is reached when you feel like you're part of a social unit. Being in a relationship is important, romantic or not. The presence of others whose company you enjoy can be fun, exciting, and relaxing. Spiritual dimension, according to the CDC, for many people this involves the personal search for meaning and direction in life. Also, which religion, principles, values, and beliefs that you use to help guide you through life. Examples would be religion, being a born-again Christian; belief, respect your elders; and in value, love your family. Having a base of values and beliefs helps you navigate through the tough times in your life and makes it easier to come to decisions based on your belief system. Environmental dimension, according to the CDC. Basically, take care of our planet. We're only given one planet. It's our duty to make sure it is still around for future generations. We can do this by recycling and not polluting our environment, land, water, and air, and invest in clean energy options, electric, solar, and wind. Occupational dimension. According to the CDC, we spend much of our lives at work. It is important to have a job from which you can derive personal satisfaction. Below are some questions you can ask yourself, but Confucius said it best. He said, choose a job you love, and you will never have to work a day in your life. And the conclusion, preventable diseases can be significantly reduced worldwide in the United States. Change in the 4 major behaviors, smoking, unhealthy diet, exercise, and excessive alcohol use, can make a dramatic change in the fight against preventable diseases. Wellness can be achieved if we are constantly trying to better our lives within each category of the 7 dimensions of wellness. But deciding to make a change in your life, your actions as a result can have a major impact on your quality and quantity of life. Thank you for joining us, and I'm going to scroll through the references.